thank you so much for coming.
Thanks
And,
for
and
having me.
chatting.
Excited to be here.
Yes, yes. Well, we have Dave Balzer with us. We're super excited.
Mhm.
Thank you for coming and chatting with us. But I would love it if you would just start off by introducing yourself, and kind of how you got into physical therapy and kind of, what brings you into pelvic health.
Yeah, of course. So, yeah, my name's Dave Balzer. I'm a physical therapist. I've been a physical therapist about coming up on 8 years now.
Yeah.
So, wow, I had to think about that.
Isn't that weird?
Yeah, it is kind of crazy. But I've been in kind of many different sectors of the physical therapy world. So, kind of
Sure.
coming out of school, worked a lot in outpatient orthopedics, sports, kind of CrossFit community, that whole thing. That's kind of why I got into the field and
Yeah.
what I thought I would do forever. If I looking back now, I never thought that I'd be working with the kind of population I'm working with today, and excited to talk to you about with the male pelvic health world.
Yes.
But yeah, I did that for a couple years, and actually my wife and I got in. She's a physical therapist as well. We got into travel physical therapy, and kind of that was the reason we got into that. It was able to give us some time and space. I kind of wanted to shift kind of my clinical things that I was working on and clientele I was working with much more into kind of holistic and some somatic based therapies and everything.
Yeah.
So that gave me a little bit more time to read and take in different information, how to kind of form my clinical practice that I knew I wanted to do for the rest of my career,
Sure.
with doing some of that travel work, and was able to see a lot of different stuff. And then, yeah, I mean, even 2-3 years ago, if you would have told me I would be doing men's pelvic health, I would have, I mean, I didn't even know, which is sad to say, but in the physical therapy world, I didn't even know that there was a need for that or kind of what it was all
Sure.
about. Obviously knew the women's part of it and everything.
Yeah.
And so, yeah, I actually got pushed into the pelvic health world from a urologist. Um,
Yeah.
Kind of just a friend. It was in the funny story in the sauna at the gym every morning, 5 a.m. squad. He was in there with
Nice.
me post workout. He was a urologist, and I was telling him I was working with a lot of persistent pain, kind of chronic conditions, trauma based stuff, stress based stuff.
Yep.
He was like, "You would be perfect for working with men's pelvic health," and I kept telling him, "No, no, not too interested in that."
Yeah.
But he kept urging me, and eventually I kind of cracked, took a couple courses, and it's been really rewarding for me and kind of the exact population that I would want to be working with. So that's kind of my story for a weird way of getting into the men's pelvic health world.
Yeah, that's awesome.
Hmm.
And since starting in the pelvic health realm, when it comes to the men's pelvic health side of things, like you said, finding you'd heard about it before with like, women
Hmm.
and pregnancy and like,
Yep.
all those types of things. But what has been some of your favorite things to treat and work with kind of in
Yeah,
this
and a lot of this
population?
stuff, I mean, like I said, a couple years ago, I would have never like how on. I get frustrated before in the orthopedic realm or
Yes.
sports realm. There'd be things like, oh, that people would say you couldn't treat or you couldn't get better, and that always frustrated me. Or especially in the chronic pain world, it's like, oh, fibromyalgia or some of these autoimmune conditions. Now you can't do anything for that. Ehlers-Danlos syndrome and some of those things. It always made me those failed patients always. I'm kind of having a visceral response now. Like it just
Yes.
really, uh, I mean, it really pissed me off when patients would come in
Yep.
and they were told that repeatedly. And there's a ton of that in the male pelvic health world.
Yes.
So sometimes if I'm listing off all the diagnoses, I'll kind of start back to front. So if we go,
Yes, yes.
if we just start with the butthole, we'll just go right to
Yes.
that. There's a
Yeah.
lot of things like fissures, constipation, um, rectal prolapse, some of those conditions that treatable from tension created in the pelvic floor. And then if we work more to the front, there's erectile dysfunction, post prostatectomy,
Mm.
premature ejaculation,
Yeah.
and even just there's the catch-all term of prostatitis, which is kind of just a junk term,
We
like
don't know what you have, so here you go.
yeah, a syndrome, in
Yes.
quotes of, hey, we don't really know what's going on, or they
Yeah.
assume a bacterial infection, some of that stuff. That's probably the most common diagnosis I see, which is
Yeah.
a ton of unknown with it. But there's many treatments. And sometimes I even bucket people to put it, those are all just lists of cool medical terms.
Right.
And I like to, look at it from a different perspective. There's either people are super ramped up and need some down training, super stressed, and there's a lot of other holistic factors in play there.
Sure.
It's pelvic floor is where a lot of stress is stored. Or there's people that are well undertrained. That's more the aging population, or you'll see it in younger population too, but they need some strengthening to that pelvic floor.
Definitely.
So those are if you take the diagnoses out of it, like those are typically the two buckets that people are in, or
Right.
there's a mix of both where they're unable to coordinate to go from a undertrained position to a
Right.
strength position.
Yes,
So
absolutely. I
yeah,
think that that's huge. And being able to, yeah, through your assessment, it sounds like you're able to identify,
yes,
where these people are, and then you're able to get them on the right track towards the healing that people say is impossible.
yeah, and even just sometimes, which I'm big into this stuff. It's a little woo woo, but even just I mean, in the guys' world of this, like nobody nobody wants to talk about this. It's hard for them to even come in and talk to me
Yeah.
about it, or I've had guys tell me like, I haven't even told my urologist about it. It's like that's what they were going to see them for, and they weren't even giving them the full story. So sometimes when they have the ability to express, be heard, and someone listen to them, then that's healing in itself right there. So I've some
Yes.
people walk out the door. I'm not saying this is some like magical thing, but I think there is something to it where they just kind of feel better just being able to get it off their chest to some degree. And that's kind of the beginning path to healing, I'd say, for a lot of them.
I 100% agree. And I think, yeah, that's like you mentioned, working with those people who have been told, like, for the longest time they're broken.
Yeah.
There's nothing we can do for you. For you to be able to come alongside them, particularly as another man, like man
Yeah.
to man, like, have that conversation and just be there. That's huge.
Yeah.
Like
And
you
in the
said, healing.
women's world, I mean, you probably see a lot of that too,
Yeah.
like a lot of gaslighting. Oh, this is just how it is. Or,
Definitely. Yeah.
yeah.
It's unfortunately a lot of the pelvic health conditions, women, men, anyone have lived with these for so long thinking there's no hope
Yeah.
or help with
It's
anything.
frustrating.
It's so frustrating, but it's so rewarding when
Yeah.
we get to help and
Yeah.
provide that pathway
Hmm.
and trajectory for them, which is really cool. Well, tell me, as a male
Hmm.
therapist, male pelvic health therapist,
Yeah.
in a often, female dominated realm
Sure.
in pelvic health, there's not a lot of y'all
Hmm.
in pelvic health. What has your experience been like professionally and interpersonally, kind of working with patients, but also other professionals in the space?
Yeah. And even just big picture, like I've always struggled in my life, like getting comfortable being uncomfortable, or
Sure.
like kind of going out there and change. And which actually doing the travel work was really nice for me because we were change every 3 to 6 months. So
Yeah.
in terms of getting out of the comfort zone there, and even in this space, I was hesitant to even, really get out there and tell everybody what I was doing or even sharing that with people. Cause it is, I mean, I some people think it might be kind of strange as a trajectory to go for
Sure.
your career and everything. It's not what I would have expected, but like you said, there's a big need for it,
Mhm.
and you can have such a huge impact on people's lives. But the biggest thing I've noticed is, yeah, there's not many men doing it, and there's a few big names out there, but I've leaned on the women's pelvic health world, and
Yeah.
even I'm a newcomer to kind of the upstate area here, and the women's pelvic health world has been so welcoming and
Yeah.
accepting, and excited to hear the options out there for a male treating males and everything.
Yes.
So it's been very welcoming. I was hesitant and nervous and all that going into it, but
Sure.
it has been very welcoming community, I'd say, which has been cool
That's
to see.
awesome. I'm so glad to hear that you've had that experience and just, feeling welcomed into the space.
Uh
And
huh.
I feel like overall pelvic health truly is, I mean, we need more of
Hmm.
you guys. We need more people in general. Come be a pelvic health therapist.
Yeah, and even in the physical therapy world in general, there's just so much like infighting and nonsense and stuff
I
in
know.
many different spaces, and it kind of in the space that I used to work in, it was always frustrating and annoying and
Sure.
competing and all that stuff. It's like we're here to help
Yeah.
people, like, and there's many different ways to do it. A good mentor of mine used to always say, there's no such thing as a bad intervention, just a poorly prescribed. There's a
Yeah.
lot of different ways to help people out,
Yes.
and
I like that.
their patients' thoughts and beliefs about how they go about it is the main factor for that, I'd
Right.
say.
Yes. No, that's huge.
Yeah.
You mentioned the urologist who kind of like pushed you
Hmm.
in towards
Yeah.
pelvic health. Were there any other pivotal experiences, patients, or other mentors who influenced your decision to pursue male pelvic health?
Yeah. It- once he finally kind of, or the message got through to me, same thing. I didn't really want to reach out to people, so I
Sure.
just listened to I mean, every single podcast I probably could have listened to in that world just to gain knowledge on it. What was it?
Yeah.
What's going on? How can you help these people? So I did a lot of that, kind of secretly researching it, secretly going. Like I said, it
Sure.
was a little uncomfortable going into that world. But then after that, I reached first. was a mentor of mine, Seth Oberst, who's in the Atlanta area. He works a lot with, teach people to self-regulate, kind of somatic-based therapies. He's a physio as well. Used to practice here in the Greenville area.
Sure.
But he kind of, there is such a somatic and kind of psychosomatic component to a lot of these conditions, especially the prostatitis
Yeah.
in men. So I kind of reached out to him initially, for getting the background in training, and that translates to athletes, some of that training as well, even just persistent pain stuff. So worked with him for a while, both myself, and then he had a good message to me. I reached out to him originally for the mentorship and the physio side of things. And then he was like, "Hey man, sounds like you have some of your own stuff to figure out, and you can only, authentically help other people to a certain degree for how far you yourself go down that path of healing." So did a little bit of work from him and mentorship from him that kind of helped me feeling comfortable and confident going into the
Yeah.
men's pelvic health world. And then since then, I mean, reaching out, reading a lot of the work from like Joanne Milios.
Yes.
Lance Frank is a great
Yes,
resource.
yes.
He's big in the TikTok world.
Yes.
Lance in Your Pants, I think, is
Love
his.
Lance in your pants. Shout out
Um,
Lance in your pants.
yeah. So I've reached out to him too, and some other male pelvic health. There's a few across the country
Yes.
that have given me some good insight and resources and everything for getting into it.
That's awesome.
Yeah.
Keep paving the way, man. Get more of y'all in here. It'd be
Yeah.
amazing. What are some common barriers that you've touched on this a little bit, but some common barriers that prevent men from seeking pelvic health, physical therapy, and how do you work to overcome those?
Yeah. Mention a couple. I think the biggest one is just first them knowing that is this many things are common but not normal. And a lot of them they just gloss over, or guys will just power through. That's probably the biggest problem.
Sure.
It isn't really that big of an issue, or who cares if I have to go to the bathroom every 45 minutes, an hour, which is not normal.
Not normal.
Or just yeah, we can go all day about that.
Yes.
But even just they'll kind of dissociate sometimes from their symptoms, whether it's pain, testicular pain, or just pain in that pelvic region,
Yeah.
or the golf ball in your gooch area or perineum.
Yes.
Some of these different sensations that guys have a pretty good capacity to dissociate from that and kind of dim it some until it just comes back to really, for lack of a better word, I guess, bite them in the butt.
Yeah.
So I think that's probably the biggest barrier is like them. You don't know what you don't know, that there
I
is
was gonna
something
say,
that
even
can.
just knowing it exists.
Yes. Yeah. And that there is help out there for it.
Right.
So that's probably the biggest barrier. Like that's the most common thing I hear on day one. So I didn't even know there was anything I could do about it, which I totally get that. So awareness is a big thing. And just comfortability for them to be able to seek help. And I think then making the choice of like, hey, there was a lot of it is, there was lifestyle issues
Sure.
that got them into this situation typically, or at least to some degree. And it's going to be lifestyle changes that are going to get them out of it too. So there's a pain recipe for the body and the brain, and there's also a healing recipe. So it's kind of tapping into that capacity to heal, which can be challenging for guys making a big change in life. I can get stuck in my own patterns in life and everything. So that'd probably be the second thing I'd say. It's like making a big life change for them to feel and heal.
Being ready to do that work too.
Yeah.
And understanding what that looks like, which is, your role, our role is being able to, let them know like what this looks like. What can change? We can make changes here, but this is the process.
Yeah, getting the buy-in for it.
Yes. Yeah.
Which can be challenging. And so I've had plenty of times where I told patients like, hey, I don't know if you're like, are you truly ready to make some of these changes? Because, you have to do the work to see the change to some degree.
Yeah.
I'm a guide or a shepherd in that process.
Yes.
With it and facilitating it, but it's coming through the work they're putting in some too.
Exactly. Yeah. And so kind of building off of that a little bit, like you said, buy-in's important, and building rapport and trust with the male patients, particularly those who either had no idea this was an option or just, again, have been in either chronic pain for years or just have been dealing with their symptoms for so long, they just don't even know life without them. How do you approach those people who are more apprehensive and or vulnerable and like in discussing those pelvic issues with them?
Yeah. I maybe even won't even go into like directly into maybe even the pelvics. Like I know that that's a problem.
Right.
And, maybe won't even jump right into treating that stuff or directly, treating some of that, and more go to then the lifestyle behavior change stuff, like
Sure.
addressing sleep, addressing their nutrition. I mean, those need to be addressed at some point for a lot of those people, or just where is their movement level at? Where is their functional capacity at? Like that has to be addressed even outside of, I mean, sometimes I get really frustrated with the traditional biomedical model where we silo things and one thing with, yes, I'm a men's pelvic health specialist, but I have to treat the whole body too.
Yes.
Like it's not just treating between the knees and the diaphragm.
Mhm.
There's other things that are going on there. So sometimes attacking those issues or the lifestyle behavior stuff,
Yeah.
and then they see a change and feel a change, and they have a relationship, and they feel like trust and building that relationship is the most important part. Like you said it in terms of promoting a healing environment for the body, especially if it's something that's been persistent. They've had they've had failed care over the years, or
Right.
they've been told they can't get better. So establish, and they've had bad healthcare experiences.
Mhm.
So establishing that trust and whatever ways that's kind of the puzzle we have to solve is
Yes.
what can I tap into to try to get them trending in the right direction, get them a couple wins, and then maybe I
Yes.
can go into like, hey, we absolutely had to address this. We got to get to this at some point.
Yeah. So
So
almost looking kind of for more like a global to specific
yeah.
approach you found with these patients has worked quite well in
Hmm.
times. Because again, like you said, these more central factors or global factors from the whole mind body
Yep.
connection, like they're major drivers, a
Oh yeah.
continued persistent issue, right? So I think that's huge and helping people again ready to do the work. It's going to be a whole body approach. It's
Yep.
not going to be just a pelvic floor
Yeah, and I found,
approach.
like in my first few years out of PT school, I found myself falling into that, typical biomedical
Yeah,
model of like, I'll just treat this one impairment at the hip or the knee
sure.
or that, and it was kind of the find it, fix it strategy. And that's why I wanted to shift. Like, hey, I kind of out of frustration, like I'm not getting these people um, as well as they should be, and it's like I know their nutrition's crap, and I know
Hmm.
their sleep's crap. They're highly stressed out, so it's like that stuff has to be addressed, or they won't be getting the most out, and I'm failing them to some degree.
Sure. If we're not
So,
giving them the whole picture
yeah,
of what's going on. And
yeah,
and to kind of go off of that too, you do some health coaching.
hmm,
Is that correct?
yep.
Can you tell us a little bit about what that looks like and how you integrate that into your practice?
Yeah, I mean, it's a funny health coach or these
Yeah,
these labels for stuff. I
I
mean, I,
know.
I just feel like that should be in the physio department, anyways. Like I was just saying, it's like
Agreed.
somebody's coming to me for back pain, yet I'm not talking about what they're doing day in day out, what they're doing sleep wise, like all that we know, all the research shows that. So like it's within our scope too to just talk through and discuss some of these lifestyle things. If there's I'm not prescribing, um, you know, nutritional protocols that are disease based or anything like that, but there are lifestyle changes and nutritional things that you can be doing for that, and that's kind of the health coaching department of things. So that's
Yeah.
looking more at mindfulness, the sleep stuff, nutrition. And then just overall their movement, like getting their programming in place and providing that for them to where they have a set program and accountability for that, and being able to communicate back and forth with me for what they're doing
Yeah.
programming wise.
That's awesome.
Yeah.
I think that's so important. And like you said, we're just missing the mark
Yep.
as clinicians,
Yep.
as physios, if we're not addressing those factors.
Yeah.
Like, because people aren't going to get better, fully,
Yeah.
fully better.
And they weren't getting they're part of it too is like they weren't getting it from anybody else. It's like I have
Yeah.
I have some of this knowledge, and I enjoy it myself too. Like I'm greedily, like I'm doing a lot of that for me, and tinkering
Sure.
with stuff and everything. So and just having that conversation,
Mhm.
they can try some things, and clients really appreciate because they aren't getting it from somebody else.
Right. Yeah. No,
So
exactly. Tell me this. What would you say to men who believe that pelvic pain, incontinence, their
mhm.
sexual dysfunction, all of those symptoms are just like normal parts of aging
Yeah.
or parts of life that they just have to deal with?
Yeah, frustrating.
Yeah.
And I perfectly blunt, 2-3 years ago, I would, yeah, that's probably true, or I would have thought that was true. Um, so I think get getting the buy-in and being able to, so kind of explaining to them the research behind it or the why behind a lot of it.
Mhm.
Um, you know, everybody is, but a lot of guys, they really, okay, if you show me how this works and why this works, then they'll do it.
Right.
And which you can get pretty good adherence to care with that too. So you can
Sure.
explain to, like, for instance, I'll just give you an example. Like for erectile dysfunction,
Yeah.
that is just for the physiology behind it. That is blood flow going to that region that creates that erectile tissue.
Yes.
If we have tense pelvic floor, like that hammock or trampoline, um, muscle tissue through there. And if that's constantly in a 10-step space or 10-step state, then we're not going to be able to get blood flow as efficiently to that area. And then also too, so we have to have first the ability for it to relax to get blood flow in. And then there has to be kind of a tensing up too of those muscles and after to kind of close the gate to maintain that erection. So if you look at hard flaccid syndrome or just, erectile dysfunction in general. So even just giving them quick explanation, I see like light bulbs go off immediately in their heads. I'm like, oh, that makes sense. Like nobody explained it to me like that.
I didn't know I had muscles down there that did that.
Yeah, exactly.
Yeah.
So I think giving them real life examples, pulling out models or pulling up, picture Google images of anatomy.
Yeah.
They get a lot of buy-in to that. So explaining it thoroughly and giving them that background of why and how they can change it. And especially if we're using that erectile dysfunction example, I'm explaining to them like that's if you're in your 30s and 40s, you're having issues with that. That's one of the biggest signs for cardiovascular disease right there. There's that. And then if you kind of another funky one, a lot of eye doctors can catch that early too, because that's where the vessels change there in the back of the eye first, or you'll see the erectile tissue.
The lack of morning erections and some of those types of symptoms.
Yeah. So it's and just explaining to that and having them same thing. It's getting information to them, promoting empowerment is my whole goal for people. The more information they have and understanding, the better they know about their body.
Yeah, absolutely. Education and knowledge is truly is so powerful for people.
It's fun.
It is. It's so fun. That's part of what I love about pelvic health is just like, man, seeing those light bulbs go off like so often, every single day, every single session. It's like, wow, like this, we're making an impact. And so is everyone in physical therapy and, the medical community. But it's very nice to have more time and the ability to go dive down some of those rabbit holes with people. What advice would you give to other male therapists who are considering a career in pelvic health or kind of like yourself who are just like not open to it, but like, enjoy that kind of holistic approach to care?
Yeah. I think for the pelvic health stuff, I think first, like there just needs to be way better awareness, whether it's in the PT schools of like, hey, this is what's going like, even if you don't want to do men's pelvic health, you should be able to screen. And like, if you're working with the low back or in that area, you should be able to ask these questions and just get the awareness out there. So like, even if you don't want to treat that, you should be able to screen for it and ask the right questions.
Love that.
To get that out. Cause like I said, a lot of these dudes are not going to tell people about certain things going on. So everybody, every PT, male, female, whatever, should be able to communicate and get those questions out of people and then refer if they don't want to. So I think that there needs to be something at the very foundation of our, because I didn't have any of that.
Yeah.
If I remember, I might not have been paying attention, but there might have been I think there was like one women's lecture or something, which I was probably reading notes from another class at that time because I thought it was irrelevant to me.
Sure.
So it's something on the foundational level that's got to be there for sure too. But then for guys just interested in it, I just listen to some podcasts or do some search on that is a great way to get into it. But even on the more holistic front of things, or I know it's kind of a catch term with the holistic stuff, but physios are the movement experts. So you need to have the capacity to program, the capacity to promote well-being and movement. We have to have the appropriate recovery, which would be the sleep aspect of things, and ramping up and and relaxing down stress-wise.
Yeah.
So the mindfulness aspect, all that goes under our umbrella as practitioners. So I think having that ability to give some information about that's really important. And seeking out resources for that.
Love that. And speaking of resources, can you tell us kind of some of your favorite books, courses, organizations, like anything that you would recommend for clinicians or patients that are interested?
Yeah, I love reading and audiobooks and all that with driving around seeing patients because I'm mobile. So I have a huge book list on my website, just davebalzer.com. I have a big book list on there. So I love reading. My mom was a librarian growing up, so I always was in a book at all times. But one of the most recommended, I know this isn't true to men's pelvic health, but I think overall, I feel like it should be required reading, like The Great Gatsby or something. But The Body Keeps the Score.
Yes. Oh
one of my favorite. I've reread it many times, listened to it a couple times. But if you're in the healthcare field, like you should be required to listen to that book. That's a great one. I'm trying to think there's a couple other. Susie Gronsky has got a really good for if you're looking in the men's pelvic health world. She's got a pretty good kind of beginner book for going into that. Sandy Hilton has a couple books on that or information online. But yeah, on my website, in terms of the holistic stuff, I have a ton of resources. Oxygen Advantage would be the more the breathwork side of things. That's a
Yeah.
good resource. A couple nutrition books like Kate Shanahan's Deep Nutrition's pretty good book.
Yeah.
Peter Attia's Outlive book's pretty solid too.
Awesome.
Yeah, there's a bunch of resources on there.
Love that.
So yeah, love
Oh,
reading. I could talk all day about that.
yes,
The
yes. That's a
different
whole
books.
nother, whole nother
Yeah,
conversation. Well, tell people how they can find you and
Mhm.
connect with you, just in general,
Yeah.
whether it's via referring a patient or even
Mhm.
just like, getting in touch and
Yeah.
wanting to talk.
Yeah. So my website's simple. It's davebalzer.com, Balzer. There's a number on there. My email's on there. You can reach out via that. I have an Instagram. I'm not all that active. I need to be better about the Instagram stuff. I try to practice what I preach to my patients, which is a lot of self-regulation techniques is
Yeah.
getting off social media and getting off the phone to kind of down-regulate and some of that. So I need a little bit of that too. But you can reach out. My handle for that is Dave Balzer DPT. So you could reach out on there too. But my website's probably the best resource. You can contact me through that and everything. But yeah, so that's kind of some
Amazing.
resources.
That's so good.
Yeah.
Well, if you had to say, let's end with, tell me kind of what is your favorite aspect of being a male pelvic health therapist? And again, any final thoughts that you would want to leave someone who is curious and or, from the patient perspective and clinician perspective, like, what you want just people to
Yeah.
them to know.
Yeah. My favorite part of it, like, um, it's a community that has a big need. And like I said before, I used to get so frustrated by it. Sometimes I'll just, if you want to use the term, just a stuck patient or a
Sure.
failed medical patient. I used to get, same thing. I'm getting viscerally frustrated thinking about some past patients that were told things by certain clinicians or doctors or things. And it's just frustrating. Like the answers are out there for people. It's just finding the right clinician. And I'll even tell people that reach out to me, like, I want to make sure I'm the right fit for you. And if not, I'll find somebody that is.
Yeah.
Because I'm not always. So I think that's my favorite part about it is there's such a big need for it, and you can make such a big change in people's lives. It's rewarding for me. Sometimes the physical therapy world can get a little tedious at times with certain things. So this is not something that's tedious at all. So it keeps me curious, and I love learning, and so it drives me in that direction. So that's probably my favorite part. And then to the second part of your question, I think just letting guys know that, if you look at the things that are, common but not normal, some of those things we mentioned, like look into that stuff, reach out, ask for help.
Yeah.
Even just mention it. Like a lot of people haven't even mentioned it to their spouse or anybody. First lean on them and get some feedback from them. And just reach out for help.
Yes, I love that. And being able to, that's the first step is just like, voicing it, saying that you do need something and then we can get you to the right people.
Yeah,
just like you.
Exactly.
Well, thank you so much for coming to chat. This has been amazing. And I'm super excited for people to get to hear what you do and how you can help them.
Yeah.
So,
Thank you. Appreciate it.
of course.